Well, folks, today is the one-year anniversary of Obamacare, and it's indeed a very sad day for America, but it's very important that we pursue the truth steadily. As George Orwell said, seeing what's at the end of one's nose requires constant effort. We're learning that all the main promises that they made are already broken. Everything is playing out just as the critics warned. The bill's sponsors said that it was supposed to lower costs, increase coverage, not ration care, and that it would let you keep the coverage plan you have if you liked it. So first of all, I ask you, what's the problem with American healthcare? Is it that our healthcare is not the absolutely very best, highest quality in the world? No, it's not that. Doctors and healthcare providers from all over the world want to be here in America, not just because of our free enterprise system or because America is on the cutting edge of emerging research or because our hospitals are the finest in the world. Doctors want to come to America to practice medicine because, well, we're great customers. Americans have had it so good financially. We've already got so much that most of the rest of the world is jealous of our wealth. We have so much, and we love our lives and our freedom so much that we've been willing and able to spend more of our incomes on health care. However, we also live very unhealthy lives. We eat too much, we don't exercise enough, smoke too much, drink too much, because we all know that there is a great hospital nearby. We play lots of dangerous sports, and we're always breaking arms and legs, and that means profit to the healthcare providers. We have liberty in America, so I believe folks have the right to live as they choose. If you're paying for your own health insurance, feel free to eat, smoke, drink, and skydive all you want. But guess what happens when the government is paying for your health care? The government has a responsibility to spend taxpayers' dollars wisely, and it has a right to demand good and healthy behavior from the people to whom care is being given. So what happens when the government needs to cut care to save money? Cuts will have to be made. We don't have enough money to pay for everything. So if we're going to avoid financial collapse, some healthcare service or some group of people needs to be cut in order to save money. And the last thing a politician wants is for people to think he's cutting someone's service. Politicians appoint, instead, a panel of elites to do their dirty work for them. And a panel of pinheads gets to decide whose funding gets pulled. The majority of American healthcare costs are obviously being spent on seniors. So where do you think the most money can be saved? Government healthcare has a conflict of interest. Hurry up and die, Grandma, the meter's running. More on that in a bit, but let's return to the first common sense question. What's the problem? If the problem with American healthcare isn't the quality of care, the superiority of our hospitals, or the excellence of our providers, what's the problem? It's getting to be too expensive, right? It costs too much. Now, some of our high costs for healthcare can be explained with the old axiom, you get what you pay for. But this is not a full or complete answer. To begin to answer the second question, what is the source of the problem? We must understand the simple economic truth of the principles of supply and demand. In short, the only way to lower prices over the long haul is to increase supply through market forces to meet the demand. Additional demand and higher prices mean that inevitably capitalists will be attracted to compete in the market. And with more producers, supply will increase and prices will fall. That's just the way it works. The working man pursuing his own interests and trying to grow the wealth of his family helps the economy grow because he produces wealth and has more to spend on productive activity of others. This is in essence the capitalist principle of Adam Smith called what Adam Smith called the invisible hand. And it's the economic foundation on which our nation was founded. The right to property and the pursuit of happiness. It's as plain as the nose on your face. If we want to lower healthcare prices, we need to increase supply. But guess what Obamacare is trying to do? He's actually trying to bend down the cost curves by reducing supply and capacity through taxation, regulation, rationing, and outright denying expensive life-preserving medical care. Their goal is not to reduce the price of health care, but to reduce how much of our income we're spending on it. They think that if we aim to reduce the total amount of health care that is provided, we'll save money. This, in essence, is trying to defy the law of economic gravity. And when there is less of something in high demand, what happens? Prices go up. It's so obvious that only an intellectual could miss it, right? So that's the problem. Prices are too high because demand is high and supply is low. But there is another problem. There is no competition in the marketplace. One of our biggest problems is that insurance companies aren't competing against each other like Walmart, Meijer, Target, and Kmart. There's not competition for our discerning healthcare dollar the way that Geico, Allstate, State Farm, Prudential fight for our insurance business. Most folks just take whatever health insurance their employers offer. And because of this, we consumers of healthcare are basically stripped out of the buying decisions. It's not within our control. I believe we should put these decisions back into the hands of the people and make providers and insurance companies compete for our dollars. Now, on the other hand, some people like George Soros and the big government Democrats think that the best possible solution is to put all of the control in the hands of a government panel to make the decisions about our health care, to decide what must be in a health care insurance policy. I believe that the best possible solution is for doctors and patients to be making these healthcare decisions. The decision over what insurance policy to buy ought to be made at the kitchen table by free individuals, not by a panel of so-called experts in Washington who are trying to save costs and who are not looking out for the little guy. They're picking winners and losers in the marketplace. Or worse, these decisions should not be made by politicians who are merely trying to bribe taxpayers with their own money. Our opponents, the big government tax spenders in Washington, have written a nearly 3,000-page law full of bureaucratic red tape and onerous regulation that will negatively affect every American. And like I said earlier, it's easy to see how all of this will drive up costs while also ruining our current system that has become the shining example of quality and excellence, even though it's become also the most expensive healthcare system in the world. But let's take a look at the promises that they've made while they were trying to sell the bill and see if the details really bear out whether they were telling the truth or whether they were merely lying to get the thing passed. I mean, Nancy Pelosi said that, well, first we've got to pass the bill so that way you can find out what's in it. Well, for the last year we've been finding out what's in it. And we have found, quite frankly, that all of the promises that they made, they haven't kept. It's not going to do the things that they said it would do. The first big lie that they told us was that it would not add one thin dime to the deficit. Remember that? How could we forget when we heard it day after day during the debate from all of the bill's sponsors? They said it will actually reduce the deficit. We don't hear them saying that anymore now, do we? We've come to find out that their bill actually increases total spending by $2.6 trillion. They promised it would reduce our costs, but in reality, it raises taxes by more than $500 billion over the next 10 years, the largest tax increase in American history. According to the Congressional Research Service, the new bureaucracy the bill created is so complex and indiscriminate that its size is, quote, currently unknowable. This is a congressional research finding. Capitol Hill's independent policy arm added also that among, quote, the dozens of new governmental organizations or advisory bodies, unquote, it is, quote, impossible to know how much influence they will ultimately have, unquote, or how much these panels will cost. According to the nonpartisan Congressional Budget Office, using the very figures that the co-sponsors of the bill gave them, premiums in the individual market would rise from 10 to 13% for families. Our debt and deficit crisis, driven by $76 trillion in unfunded liabilities as of 6 months ago, would accelerate from the creation of a brand new entitlement and increase the federal deficit by $662 billion when the true costs are factored in. These are the numbers from the Congressional Budget Office. Before the bill was signed into law, its sponsors all repeatedly insisted that the reform would bend health care spending downward. This is more than a stretch. It is a dream. When in the history of a government program has an entitlement cost what they promised? The CBO says over half of the new $940 billion health care entitlement is paid by price-fixing Medicare's cuts. Never mind that the President's own Centers for Medicare and Medicaid Services says that these cuts would cause roughly 20% of Medicare providers to go bankrupt in Obamacare's first 10 years. Does that sound like raising supply to meet demand? If 20% of Medicare providers go bankrupt in our first 10 years, does that sound like we're raising supply to meet the demand, or is that really just cutting capacity? Does it make sense why countries with government-run healthcare have such long waiting lines? If you don't have one yet, you better beat a crowd and find a doctor before the government puts these doctors out of business. They promise that if you like your plan, you can keep it. This is demonstrably false. This is the biggest lie of them all. The healthcare bill nationalizes the regulation of health insurance premiums, usurping a state government role and further smothering the normal market forces that would otherwise encourage innovation and cost-saving efficiencies. Now, not a month after the bill was passed into law, we started to see the effects of it on the job creators. And we began to learn that this bill is a job killer. Its pay-or-play plan was sold to us as a way of encouraging employers to provide coverage for their employees. But what it will do is exactly the opposite. If the penalties for not offering insurance to employees cost companies less than providing health insurance coverage, what do you really think is going to happen? Employees have been being and will continue to be pushed off of their company insurance and forced to buy a government subsidized plan. As employers analyze the law's effect on their bottom lines, they are already seeing huge rate increases. Government has made our job creators' choices very clear. Either increase prices or cut costs. A little red meat there. Inside the bill's 3,000 pages, the Secretary of Health and Human Services is mentioned almost 2,200 times. It uses the phrase, quote, "the Secretary shall," unquote, more than 725. Each reference requires the Health and Human Services to set new rules on medical care, giving control to an existing federal office, or one of 160 new agencies that the bill has created. HHS Secretary Kathleen Sebelius is now known as the nation's insurance regulator-in-chief. She's the Madam of the House of the Health and Human Services. And she looks an awful lot like, stop with the jokes, Darren. Cruella de Vil. Health and Human Service Secretary Kathleen Sebelius, also known as Cruella de Vil, is now known as the nation's insurance regulator-in-chief, and she's starting off by applying new regulations to health plans offered by large employers. Go look it up. Here's the bottom line of it, though. Sebelius means to dictate what your insurance plan must look like from almost day one, no matter how you got your coverage. Ultimately, these rules force consumers to buy one of just 4 health policies, which vary mostly only by trading off higher co-payments for lower premiums, while offering essentially the same actual benefits. Eventually, this will force all but the very wealthiest Americans into a single government-designed insurance scheme.